All right, thanks for joining us. We're talking about eyelids today and eyelid surgery. We're going to be talking about upper and lower eyelid surgery. We're also going to talk about brow surgery and how we correct droopy brows. That's not applicable to today's case, but we're going to mention it because we think of this area, the area around the eyes, as the periorbita. That's a fancy way of saying area around the eyes. So let's get started. So when I examine someone's periorbita, if they come to clinic with concerns about aging around their eyes, I just start top to bottom. And first of all, we look at this distance. I typically look at the hairline here. She's got good follicular density. That's a nice way of saying nice, dense hairline. And I look at this distance, the distance from her hairline to her brow, and that's appropriate. Next thing, I look at the shape of the brow, and again, she's augmented this, as many women and many people do, to be a nice arch. They do this often because things are thinning, and not everybody has a thick eyebrow. But what I really like about her eyebrow is the way it starts wider and tapers to a nice thin brow. And it also, right here, and again, this is called the lateral limbus. That's getting really technical, but this outer edge of the iris, it's about 1 centimeter over the bone right here, the upper edge of her eye socket. And that's desirable, perfect, not a lot of horizontal wrinkles. Not a lot of wrinkles here in the glabella, a little bit of a wrinkle right there from the procerus muscle, but overall, very nice position. Moving on to the upper eyelids, she's got some crepey skin. This is called dermatoclasis, and it's just extra skin of the eyelid, in her case associated with aging. And we typically check the upper eyelid function to make sure that the upper eyelid's functioning properly. In her case, we already checked that it is. She's got beautiful green eyes, and we want to accentuate those. And another way we're going to do that is to, in addition to getting rid of the extra eyelid skin, is to address the lower eyelid skin. Some crepiness here. This line right here, which is a demarcation between the lower eyelid and the cheek, is called a tear trough. And we're going to efface that. We're going to make it so it's not so deep. And we're also going to raise it some. At the end, we'll be doing some skin resurfacing to help transition the two types of skin, the cheek skin and the slightly discolored lower eyelid skin, because what we think of as an attractive eyelid is one that is confluent with the cheek. Hello Nashville, thank you for tuning in. We're back today with Juliet. She is 8 weeks out from upper and lower eyelid surgery. That's what we're going to talk about today. We did some other things like a chin augmentation and a facelift, but we're not going to focus on that today. We just want to feature her eyelids and discuss those. So we're going to do a physical exam, talk about our findings. I'm really happy with the way things turned out here. She had some crepey upper eyelid skin, although her eyelid muscles functioned very nicely. We didn't have to do a lot of work there. Lower eyelid skin also had some crepiness to it. We had some what we call a tear trough, which is a demarcation between the lower eyelid and the cheek. We wanted to soften that, so we removed a little fat from there, redraped some of that fat to transition that zone between the lower eyelid and the cheek to make that nice and smooth for a nice youthful appearance. I think she's real pleased. I know I am, and we'll talk to her in just a few moments and do our exam. Close your eyes for me if you can. Sometimes people, they're concerned about scars, and the scars are really, you can't even see them. You did great. You healed so well, and that's really common of the eyelids. That is to say that the scars tend to heal really well. Open your eyes if you would, Juliet. So what I like to see today, which is what we see here, a really nice crisp, and I'm not going to poke you in the eye here, just use this as a pointer, but a nice crisp upper eyelid crease, which really looks great here. On the lower eyelid, we did a few different things. We went here through a small scar, again on the lower eyelid, small incision here. Again, you can't see that. It tends to hide very nicely. We also removed and redraped a little of the fat under the eyelid. It looks really, really nice. Got rid of some crepey lower eyelid skin. Looks fantastic. I like your shape. She obviously helped us a great deal by bringing those lovely green eyes, and that's what things look like 8 weeks out.